Hi, Dr. Bux. How are you?
Hi, doing all right. How are things?
Great. So, Dr. Bux, do you mind telling me a bit about how you got into emergency medicine?
So, emergency medicine specialist, I basically used to work in pediatrics and used to see a lot of children. But during that time, the losses for the children used to get quite a bit to me. So, my personality suited more a fast-paced environment where I can do more in a faster way. And the opportunity came by to specialize in emergency medicine. And I jumped on it. I was the first in the history of Guyana to get into the specialty. And I was, yes.
And since then, what has been the transition at the hospital for you?
It has been quite a lot. When I came here, this wasn't even a specialty department. So we created this as a specialty, and we've created an entire structure now that moves from just being on a surgery, working on the surgeons, to now an independent department that takes care of all the emergencies throughout the country.
Dr. Zulfikar Bux is the head of emergency medicine at the Georgetown Public Hospital and has spent 15 years planning and creating the first ever emergency medical service, EMS, in Guyana. These are the first responders to accidents, medical emergencies, and in the cases of fires, they accompany firefighters. The 39-year-old director of EMS in Guyana hails from Cotton Tree, Berbice, where he saw the need for first responders. He told the newsroom that after working as a pediatric surgeon, he realized that life-saving emergency interventions was where he was needed. He worked vigorously to make accidents and emergency response here better. After earning his bachelor's in surgery and medicine from the University of Guyana in 2007, Dr. Bux underwent specialized training at the Vanderbilt University. During his time at the university, he developed the research and planned for establishing the emergency medical service.
So, Dr. Bux, what is the development for emergency medicine on the ground here at GPHC?
So we've gone from not having any specialists to see patients in the emergency department to now 24/7, 365. We're staffed with specialist trained emergency doctors, specialist trained emergency nurses who work together as a team to save all the lives that are being saved, whether it's a heart attack, whether it's a big trauma, or it's a gunshot wound. Whatever you come with, these guys are all specifically trained to manage these emergencies.
How many EMTs or so do you have on the ground here?
The emergency medical technicians are not on the ground here. They work with the fire services. So the station where they strategically spaced station at the Guyana Fire Services, where if there's an emergency call, they get to members of the public faster. Then they communicate via radio to emergency specialist doctors here who will advise them what to do. And then by communicating with the doctors, they will be ready when the emergency come in to start that resuscitation and save that life.
Roger, control 11 and crew receiving. Over.
More nurses and doctors have since received emergency medicine training. The government of Guyana and Vanderbilt Medical Center supported Dr. Bux with the piloted emergency medical service. It was launched in 2013 after he completed his residency. For the start, he trained 10 emergency medical technicians, EMTs, and they worked as the hospital's emergency response unit. This critical service, though new to Guyana's healthcare sector, is expanding, and just last year, some 9 EMTs became certified to perform more advanced medical interventions.
The first case I saw was a police officer that was brought to the hospital. Unfortunately, he was hit down by a car and dragged about 100 meters. And his colleagues all brought him holding, 2 of them holding his hands and 2 of them holding his leg, and his neck was hanging. Unfortunately, he sustained spinal injury because of how he had spinal injury from the accident, but because of the way he was transported, it didn't help him, and he was bedridden for the rest of his life. So I realized that, these patients are not coming to us in a proper way, and I worked quite a lot with my residency project to develop a plan to train first responders. So without any resources, without any money, I just reached out to the police force and say, hey, I'm going to train the police officers because they're on the road.
But Dr. Bux's goal is to have teams right across the country. He got an extension into the Guyana Fire Service after a meeting with then Fire Chief Marlon Gentle. By 2016, a document was approved by Cabinet and the National Fire and Medical Emergency Unit was established.
Currently, we have good coverage in Region 5, Region 4, and we've just started in Region 3. Before the year is out, we would like to also cover Region 6 and head to Linden. The ultimate goal should be achievable by 2026, where anywhere in Guyana, if you have an emergency vital land route, you can have access to an ambulance unit 24/7, 365.
The EMS director said saving lives is his main priority, and the interventions of EMTs in the face of emergencies has saved thousands. Reporting for the newsroom, Lazina Yearwood.